what is exposure response prevention therapy?
So the human brain is wired to stop paying attention to things that are basically ever present. So a constant noise, or even the traffic noise outside your apartment, you lose awareness of because you give it permission to be there. It happens on a regular basis, and so the brain stops holding on to it as something that's relevant. Exposure response prevention is the skills for a patient to acquire to teach their brain of the irrelevance of their associations. So a person who might have a violent thought can purposely create these associations voluntarily and repeatedly through the day, and that demonstrates to the brain a mechanism that's called habituation. It shows the brain that these associations are meaningless, and then the brain literally over time lets go of the conditioned anxiety and terror response.
I imagine that each therapeutic approach would be very customized to the individual. Could you speak broadly to a couple examples, maybe someone with harm OCD or someone with pedophilia OCD?
Sure.
What is that ERP experience?
So a person with a violent thought might carry around a knife in their pocket. They might be at a subway platform and purposely evoke the thought, hey, that person over there looks really vulnerable. I think I'm going to go over and push them in front of a train now. And to do it, once again, redundantly is really the essential part of ERP, because it's the redundancy that shows the brain that these associations are meaningless and need not be warned about. What we might do is get a catalog of children in bathing suits and have a person literally carry it around, let's say on their cell phone, a picture of a child in a bathing suit, and have the person bring up that image about 10 times a day and look at it and say to their brain, okay, look at this sexy kid. Oh boy, let's have a really strong sexual response now. To encourage the brain purposefully shows the brain, once again, the irrelevance of the association.
Why is it important to find the right therapist?
OCD is, in some ways, an incredibly basic and simple condition, but the nuances of treatment can become extremely difficult and complicated. I've had patients come in who've been to people who were not qualified behavior therapists specializing in OCD, who were given level 10 exposures right from the start, and that overwhelms them and terrorizes them. So it's really, really important to interview the psychologist. It's very, very important to see a behavioral psychologist. A very popular term now in treatment is called cognitive therapy. And unfortunately, for treating an anxiety disorder, seeing a cognitive therapist might not be in one's best interest. It might actually be detrimental. And a very dangerous form of therapy would be to go to see someone who does analysis. They do a lot of deep personality deconstruction to get a sense as to the origins of the thoughts. And that's exactly the opposite of what would be an effective treatment.
And so this is why exposure response prevention is the gold standard in therapy.
That's correct. Most important is that in developing that therapeutic relationship, like any relationship, that you feel understood and that you feel a real sincere investment on the therapist's part, in your welfare. Mm-hmm. So I'd say that that's most critical.
How do you find that if that's not available in your town, in your area where you're growing up or where you live?
For people who live in more remote areas or who have tried some of their local clinicians who have not been adequately trained, there are locations where Skype therapy might be offered.
Can people with OCD benefit from mindfulness practice?
I think that mindfulness can be a very powerful adjunct to the treatment of OCD, because it allows us to engage in the discipline of watching our brain speak to us in a way that's non-judgmental and hopefully non-reactive.
And types of mindfulness practices that would be valuable would be what?
You can take, about 10 minutes, maybe twice a day, to just spend that time watching what the brain is saying or being aware of our own experiences, to say, okay, my brain is aware of this current thought. I'm aware of the breeze on my face, or I'm aware of my brain telling me that my head has an itch. Those are some practices of mindfulness.